Coming up on the Doctor's Hospital podcast.
One big myth that pediatricians deal with every single day is that vaccines cause autism. And that is a theory that has been conclusively debunked by a multiple of studies.
At Doctor's Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off lab, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctor's Hospital, trusted and best care now.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And today we are talking all about autism and autism awareness. For those of you listening, if you're not aware, April is Autism Awareness Month, not just in the Bahamas, but across the globe. And we are excited to have on the podcast today Dr. Ayana Remy, who is a pediatrician. And from everything that I've been told, she is one of the premier voices on autism in the country. We've been trying to get we've been trying to get her on the podcast for I think about 2 years now, and finally our schedules have been aligned and we have an opportunity to talk with her. So welcome to the show, Dr. Remy. We're happy to have you on.
Thank you so much for having me. It is an absolute pleasure to be here today. I'm excited about this, and I'm really looking forward to talking about autism.
Awesome. So I like to start at the ground floor when we talk about especially new topics. We've not covered this before on the podcast, and obviously with a first-time guest. So can you provide us with an overview of the autism spectrum disorder, including its origins and the current understanding of it within the medical community?
And that is an absolutely fantastic place to start. So autism is what we call a neurodevelopmental disorder. When we use the term neuro, it refers to the nervous system and the brain, while developmental refers to how the nervous system grows and develops. So to its core, autism is essentially defined by 2 arms, right? The first arm is that you have challenges or difficulties with social skills and interaction. And the second arm involves restrictive or repetitive behaviors and activities. So with autism, we have these signs and symptoms essentially developing or showing their face very early on in life, usually less than the age of 3 years. And the word spectrum in autism spectrum disorder is really important because it essentially means that no 2 children with autism are alike. It highlights the fact that autism essentially exists on a continuum,
Right.
with different individuals experiencing varying degrees of severity, from those who are mildly affected to those who are more severely affected. So there's no real one size fits all definition for what autism looks like.
Okay. So what is the current understanding in the medical community of autism?
Well, as far as etiology is concerned, in general, we're looking at individuals who have a genetic predisposition
Okay.
to developing autism. So there are a lot of recent studies out there that shows that there are very strong genetic underpinnings for autism, meaning that there is a strong hereditary link.
Okay.
Not so much in that there is a single gene responsible for it, but a sequence of genomic patterns. And this is also influenced by environmental influences. So what happens during pregnancy, for example, what happens with maternal and paternal age, or exposures to different toxins and drugs and so on.
Okay. So like you mentioned, it's a spectrum and there's a lot of different ways that it presents. So can you kind of walk us through some of the common signs and symptoms, understanding that it varies as you go from patient to patient. But can you kind of walk us through what some of the common signs and symptoms are, and how do they typically manifest in children?
Sure. So when we're looking at the signs and the symptoms of autism, we're really, again, looking at those 2 diagnostic arms, right? So the first arm that we spoke about was the impairment of social communication and interaction. So we're looking at things like how they respond. How does your baby respond to you? How does a 6-month-old baby respond to you? Are they babbling? Are they smiling back at you when they're 2 months? Is there that kind of back and forth reciprocal behavior? Are they looking at you or looking the direction that you're pointing to? Are they showing or reciprocating the facial expressions that they're showing you?
Mm-hmm.
How do they talk and how do they speak? And it's not so much the number of words, but also the quality of the speech and the quality of the conversations that they're having with you. Some of the kids, especially when they're a little older, may have a very monotonous or robot-like tone. And at the extremes of that, we may have kids who have a very sing-song kind of pattern of their speech, where they're not just interactively talking to you, but they have repetition of certain jingles that they may have heard on the television. Another thing that we see a lot of parents say is that they're very proud of the fact that their kids can, by rote count to 20 or count to 10. But that's really not as important as the interactive speech. So we're actually looking for things like the absence of things like saying hi and saying bye and mama and dada, because these are caregivers who are very, very close to the kids.
Right.
Another thing that if you look along the lines of repetitive behaviors and restrictive behaviors, repetitive movements are very common. So things like what we call stimming behaviors. So they're going to be, flapping their hands a lot. They're going to be rocking and spinning. And in some cases, that's what we call stimming behavior. And the reason why they exhibit those behaviors is because it actually helps them to self-regulate and deal with the anxiety and the discomfort that being in different social environments bring. Another big part of that is resistance to change. So they may become visibly distressed if there's a change in the routine. So you may have like a 2-year-old who's used to a certain route, for example, on the way to school that mommy and daddy take every single day. And if there's a change or a detour, they actually visibly get very distressed if that happens. There's restriction in terms of how they move and how they coordinate. So we see very clumsy patterns of walking, or sometimes even walking on their toes as well. And then some of the kids on the spectrum have very, very sensory sensitivities. So things like lights and sounds. You see them, closing their eyes a lot, or even blocking their ears if they're exposed to loud noises. And some of them may just show absolute indifference. So if they're in pain, for example, you may not even know, or they may be hypersensitive to those sensory stimuli. One more part of that arm of repetition is really the repetition in terms of the interest. So the older child, for example, may be very interested and hyper-focused on something like dinosaurs or on planets, and that's really all they talk about. To the extent of where they're really not interacting that much, or, trying to involve or bring in other people into the conversation because they're so obsessed with what they're talking about. Part of the diagnosis can also involve the changes in the developmental trajectory of a child. So we have a child, for example, who at the age of 1 was saying mama, dada, and after that, a parent may come in and say at 15 months, well, doc, I'm not hearing the mama dada anymore. So it's almost like a sudden loss in a milestone that they would have achieved before. That is sometimes a red flag for it becoming a sign of autism.
Okay. You mentioned stimming. So is that similar to like people who say like they have a nervous tick? Is that something different? Like, so I guess the question I would have is it possible that you have someone who is on the spectrum but gets to the adulthood without even knowing? Like,
Absolutely.
okay.
So I think with the exposure and to early diagnosis and education, a lot more people are coming forward for testing. Years ago, when we were in our own classrooms, there was always a kid, I'm sure, who we consider just a little different, right? We had the kids who weren't necessarily engaging in playtime. We had the kids who were by themselves all the time. And in general, we may have called them, a shy kid or awkward kid. What's happening now is that these kids are actually getting diagnosed as having
Mm.
autism. So yes, I'm sure there are many people in my medical class, for example,
Mm-hmm.
who now, when they were younger, may have been diagnosed with autism
Mm-hmm.
or a form of it.
Right.
And with the new DSM-5 criteria, what's happened is that a lot of these other diagnoses, for example, Asperger's syndrome
Mm-hmm.
and Rett's disorder, and a lot of these other diagnoses have all been lumped with the new DSM-5 criteria as autism spectrum disorder. So we're picking
Interesting.
up a lot more of these individuals who are getting that diagnosis now.
Okay. What does the assessment process look like for a physician who may have suspicion of a child or even adult um, having or being on the spectrum, on the autism spectrum? What does that process look like for assessing that person and coming up with a diagnosis?
Okay, so we essentially looking at behaviors. Autism is entirely a behavioral diagnosis, and so we're looking at behaviors through history.
Mm-hmm.
We sit down and take the time to talk to our parents and get a good history in terms of how they behaved all the way from birth to their current chronological age,
Mm-hmm.
looking for those social interactive delays and those repetitive behaviors. Um, we then do direct observation either at the consultation,
Mm-hmm.
and we rely heavily on screening tests too. A screening test is very different to a diagnostic test. A screening test kind of helps to flag the children who are at risk for autism.
Mm-hmm.
So while it's not diagnostic and not foolproof, it helps us to decide which kids we want to look at a little bit closer. And the screening tests are usually done at about 18 months and 2 years. The MCHAT in particular is one most pediatricians would start with in their offices. And then we move on to the diagnostic tests. And these include things like the ADOS and the ADIR, and they're really a lot more. And then we talk to our friends, right? So we talk to speech therapists, we talk to occupational therapists, we talk to behavioral therapists who would have played a part in the assessment of that child, and we come together and decide on whether or not they're really fully meeting criteria for autism.
So as you mentioned, obviously, there's been a lot of changes in people's understanding of the spectrum and what all sits on the spectrum over the years. But you know, as always, there are still many myths and misconceptions that people have surrounding autism. Giving you an opportunity, I'm sure, as someone who works in your space, that you know a number of them offhand that are the big boys. But can you speak to these some of the big misconceptions and dispel them for our listeners?
Right. So a myth is like essentially a misconception that cannot be supported. That's a big thing. It cannot be supported by scientific evidence.
Okay.
So the idea that has been culturally, it's an idea that's culturally been passed on for generations or through anecdotal experiences of
Mm-hmm.
individuals. One big myth that pediatricians deal with every single day is that vaccines cause autism.
Mm-hmm.
And that is a theory that has been conclusively debunked by a multitude of studies,
Mm-hmm.
and like millions of dollars in research. There was this really big Danish study, which was published in 2002 in the New England Journal of Medicine. And it was updated again in the 2019 in the Annals of Internal Medicine. And that involved over 650,000 children who were born in Denmark from 1991 to 2000. And it was really comprehensive research, which compared children who received the MMR vaccine and those who did not. And using very, very detailed national registry data, they were able to track the incidence of autism.
Mm-hmm.
And both the original and the updated studies showed absolutely no increased incidence in the children who actually received the vaccine. That's a big one. And then just to go back, one of the reasons why this whole MMR autism link came about was because of a physician by the name of Dr. Andrew Wakefield.
Mm-hmm.
And he's a very controversial figure. He became infamous for his role in promoting that idea that the MMR vaccine caused autism based on a study that he published in 1998. And essentially, he suggested that the vaccine caused like a bowel disorder that led to autism.
Mm.
But it was really only based on a very small sample of about 12 children.
Oh, wow.
Right? And so there were conflicts of interest and there were ethical violations to the point where the Lancet in 2010 retracted his study,
Mm-hmm.
cited these ethical concerns, and he subsequently lost his license from the General Medical Council because it was found that he had acted dishonestly and irresponsibly. Nonetheless, the impact of that study, like we see every single day today
Mm-hmm.
with our own patients,
It
still
reverberates.
resonates.
Mm-hmm.
Exactly. And we still have patients who refuse the vaccine to this very day.
Right. And I think it's important, to note that statistical significance, things like that govern whether a study is acceptable or not is a critical part of our conversation, right? So obviously, a study that only captures 12 people is not going to carry the weight of something where, like the other study you mentioned, that was 650,000 people over a long space of time, right?
Right.
So that's obviously the big one. Any other myths that you want to speak to and have an opportunity to dispel, feel free to go ahead.
Another big one is that parents of children with autism, the parenting is what causes autism. So that the parents parent their kids without that loving and empathetic approach. And that is one of the biggest myths out there, because the parents of or the autistic kids who I deal with are loving and empathetic, and they're some of the most engaging parents that you'd ever meet.
Mm-hmm.
So I just want to stress to our audience that the parenting has absolutely nothing to do with your child developing autism.
Right.
Another one is that autism can be cured. It really can't. And if you talk to anybody who's autistic, it's something that they eventually are proud of,
Mm-hmm.
because it's essentially a neurodevelopmental disorder. And while therapy can definitely help them, it doesn't necessarily cure it.
Right.
It's a lifelong diagnosis.
I think the idea there is more trying to add quality to life, more so than trying to find something or having something that is curative.
Right.
Okay. Understood. Right. So our last question before we go to break: what are some effective treatment approaches for children with autism? And given that it is a spectrum, how do interventions vary depending on the individual?
Right. So there's no one size fits all treatment for autism. Treatments are usually tailored to the individual needs of the individual. And these may include behavioral interventions, speech and language therapy, occupational therapy. A big one that we hear all the time is ABA. And it really involves reinforcing positive behaviors and reducing harmful ones. And there's some new emerging therapies out there. Medication for the kids who have comorbidities, like those who have like ADHD and anxiety. So I want to stress that it really is tailored to the child, but lots of early intervention strategies available.
Yeah, I know that was something we had the two of our speech language pathologists on earlier this month. And that was one of the things that they mentioned as well, was the the critical need for early assessment, early diagnosis, and early intervention as being a critical part of the process as well, and ensuring better patient outcomes. So we're having a great conversation thus far with Dr. Remy, talking all about autism awareness this month. We'll take a quick break for a few words, and we will be back shortly on the Doctors Hospital podcast. Doctors Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at the Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctors Hospital Specialist Clinic. Welcome back to the podcast. We are continuing our conversation with Dr. Remy on autism awareness. So we know that like many diseases and disorders, autism is something that affects not just the individual that has it, but also impacts the family, the friends, the loved ones that are involved as well. So in your experience, what challenges do families often face when navigating the diagnosis, the treatment of autism, and then what support or advice can you give them on how to navigate that?
Yeah, the challenges that families face are real and they're ongoing. The diagnostic process in itself can be very stressful, and it's just the beginning of a lifelong journey, I think, of ups and downs. The biggest challenge here in the Bahamas and the rest of the Caribbean is really access to both resources and services. And unfortunately, this varies greatly depending on the location, the geographical location, and the socioeconomic status of the family. For any family, therapy in itself can be a huge financial burden because it's continuous, and this can start off from infancy all the way to the teenage years. And for even those who end up getting some assistance with therapy, the wait list for therapy can be really, really long,
Mm-hmm.
right? So that's the biggest thing. I think access both to services and access to the financial means to be able to get the therapy that they need. Another big challenge, I think, is that once we get them established in therapy, especially if they're school based therapies, services that we offer to the younger ones, when they get older and have to, interact a little bit more independently in the community, the services available to the older, younger adult population, which help them to, facilitate life skills and
Mm-hmm.
coping skills, there is really a scarcity of services there for them as well. So we may get a lot when they're younger, but when it's time for them to move on to live very independent lives,
Right.
that really is difficult for them. Um,
Yeah. I mean, I think the interesting thing there, obviously, again, going back to the concept of it being a spectrum, I know with our SLP team, one of the things they indicated was, you will have people who are on the spectrum and have a lot less of a challenge navigating being independent as they get older, and obviously you have others who have a lot of challenges with navigating that. Is there anything that is being done or that can be done to enhance the resources for young adults and individuals with autism as they grow into adulthood?
Yeah, I think with the help of advocacy groups like REACH, which I'm
Mm-hmm.
sure you've heard of, they've been moving towards, a lot of occupational therapy based services,
Mm-hmm.
which arm these individuals with the, foundation to be able to, from a very early age, wean themselves into a more independent living.
Mm-hmm. Okay.
Um, I'm not sure that they're available that many, and I can't really name any offhand, therapeutic avenues available here in the Bahamas for the older population. And a lot of our parents are actually seeking help
Yeah.
from.
I mean, I think it's something that, obviously as a health community, we need to take a look at. And probably even from a corporate social responsibility standpoint, I think there's a lot of based on what you're saying, there's a lot of opportunity to
Mm-hmm.
find ways to provide assistance. And hopefully, as we do things like this and we have conversations like these, we're gonna have Reach on our lecture series
Mm-hmm.
later this evening actually, to talk about it a little bit more as well. So we're hoping that even from our perspective, having the opportunity to get the information, the knowledge, the understanding of out there a bit more, that we can shine a light on it and hopefully bring more resources and
Mm-hmm.
encourage others to bring more resources to the table to find ways to provide assistance for
Mm-hmm.
those individuals as they grow into adulthood, and are trying to navigate that independent life
Right.
with being on the spectrum.
Mm-hmm.
So you mentioned this earlier when you talked about, back in school days, you might look at someone and say, they're just the shy kid,
Mm-hmm.
or they're just the kid that stayed to themselves.
Mm-hmm.
And obviously that kind of level of understanding has shifted and evolved over time. But can you talk about, just even in the medical community, how the understanding and management of autism has evolved over the years? And then are there any advancements that you're aware of or things that are on the horizon for advancements in whether it's screening, diagnosis, care, support in the future?
Yeah, I think there's been a shift, certainly within the medical community, as viewing ASD as a disorder that needs to be cured and more into one of understanding. The big buzzword now is that of neurodiversity.
Mm-hmm.
And neurodiversity is like a social movement that essentially advocates for viewing neurological differences in individuals as natural and normal variations in that human genetic makeup,
Mm-hmm.
right? So it essentially challenges the traditional view of autism as a disorder or a deficiency, and instead it's promoting the understanding that autistic individuals have their own unique brain functions and social behaviors that should really be respected and valued, just as those of more neurotypical individuals. So essentially, it teaches us to value differences and
Mm-hmm.
embrace diversity. As far as the trends are concerned, there's a lot of tech in the autism world, with autism apps and communicative devices, even some really cool virtual reality platforms. There's
Mm-hmm.
wearable tech that monitors the individual's responses to different environments. Another big one now is biomarkers for autism. So a
Okay.
biomarker is essentially a test that you can do to essentially measurably indicate the presence of a condition.
Mm-hmm.
So things like, for example, a cholesterol level, or a weight or a height or blood pressure, to detect any sort of diagnosis. What we're
Mm-hmm.
looking now in autism is something as cool as eye tracking technology, which is a very new technology which measures where and how long a person looks in various elements. And with even the really, really young kids, as young as 9 months, there's some fascinating studies out there and research out there where the areas that they look, especially if it's geared more towards non-social interactions,
Mm-hmm.
can help to pinpoint whether or not that child becomes one who develops a diagnosis of autism.
Oh, wow.
And other biomarkers, not just the eye tracking, but things like, specific genetic tests and some metabolic or biochemical biomarkers, some neuroimaging biomarkers. So that's where the field of research seems to be moving towards.
Okay. So just I guess in particular ways to get a better understanding earlier, and to be able to diagnose earlier in the process.
Exactly.
Right.
Exactly.
Okay. I mean, because I guess as with any medical condition, the earlier you know, the better it is because you got to jump on um treatment and support.
Right.
So I guess jumping off of the topic of early intervention,
Mhm.
what role do programs, early intervention programs, play in supporting children with autism? And how can parents identify the most appropriate interventions for their child?
Right. That's a great question.
Hmm.
So early intervention in autism is critical, and it works because it essentially leverages the incredible adaptability of the young brain. Right. So
Hmm.
we see it every day with our own little kids, right? They like sponges. They take everything in and they
Hmm.
learn a lot every single day. And when they're doing that, they essentially forming these new neural connections based on the experiences that they're going through. And that's the whole concept of neuroplasticity. That's another buzzword that we hear all
Hmm.
the time. Neuro, like we said before, is the brain, and plasticity means that their brains are essentially very malleable.
Hmm.
And so the potential for shaping development very early on is tremendous. And what we're doing is enabling the brain essentially to rewire itself that maximizes a child's development during that critical window of learning.
Hmm. Okay. That's um that's good because I imagine that idea of trying to figure out what to do, where to go, where to go, who to see,
Right.
all of those things are quite pressing for
Right.
someone who feels like their kid is on the spectrum or potentially on the spectrum.
Right.
So as we wrap up our conversation,
Sure.
again looking at the observation of Autism Awareness Month, what message would you like to leave with our listeners about fostering a greater understanding and acceptance of individuals who have autism in our communities?
I think that an autism diagnosis is actually the beginning of a journey that teaches us all so much about resilience and patience and understanding. I think that it teaches us to embrace our kids for who they are and to celebrate every win and see them through every single challenge.
Mm-hmm.
From a pediatric perspective, I understand that if a pediatrician or a healthcare provider advises you to get your child evaluated, it can be a very daunting and sometimes even a very scary experience. I see it every single day in my practice. But the message that I want to get across, that it doesn't always, number one, it doesn't always lead to a diagnosis of autism. And even if it does, it's actually okay, because the process of evaluation in itself is helping us to identify the different challenges that your child is going to experience, and get them into the therapy programs that they actually need, that we know that can actually help them. And a lot of parents worry about labeling their child, but I want you to know that the process is not about labeling or limiting your child. You're actually helping them, just as you would want to help them by getting an x-ray to see if they have a pneumonia or if they have a fracture. That's exactly what we're doing with the evaluation. And the earlier we can get to that point of evaluating them, the greater the chance that we have really of getting them to the point where they can meet their optimal potential. I don't want us to see autism as a negative diagnosis. I actually wanted us to see it as just appreciating that these kids just think a little differently, because their brain essentially just works a little differently.
Right.
And it is accepting who they are and seeing that difference more as a profound power that can allow them to become their best self.
Awesome. This has been a great conversation. I want to thank you very much, Dr. Remy, for taking time out of your busy schedule to join us today. It's been a pleasure to have you on and walk through this conversation with you.
And it was an absolute pleasure being here today. Thanks for having me.
All right. And for our listeners, as always, we invite you to like, comment, subscribe, and share. And also join us this evening when the podcast comes out. It's Thursday. So Thursday evening, April 25th at 6:30 p.m. On Zoom as well as on YouTube for a panel discussion on autism as we close out our conversation around autism awareness during the month of April. And as always, we'll see you back here next week on the Doctors Hospital Podcast.
Doctors Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.